But the kidneys affect fluid balance, circulation, and waste removal. When they struggle, visible changes appear. That's how the body communicates early kidney stress. Why visible signs matter. Blood tests are not always done routinely. Early kidney disease can exist even when energy seems okay. What this series is and is not. This series is educational, preventive, awareness-based. It is not about fear. It is not about self-diagnosis. Seeing one sign does not mean kidney disease, but seeing patterns, especially when signs repeat or progress, matters. Why the kidneys affect the entire body. The kidneys regulate fluid levels, electrolytes, blood pressure, waste products. That's why signs appear far beyond the urinary system. Who should pay special attention? This series is especially important if you have diabetes or high blood pressure, have heart disease, take long-term medications, have a family history, or are over age 50. But kidney disease can affect anyone, including people who feel mostly fine. What to do if you recognize signs? Do not panic. Do not self-diagnose. Instead, observe changes over time. Notice patterns. Discuss them with a healthcare professional. Early kidney disease is often manageable. Advanced kidney disease is far more difficult to treat. Timing matters. Kidney disease rarely announces itself loudly. It whispers, and it whispers through visible signs. Learning to recognize those signs early can protect your kidneys and your future health. Join us as we learn to listen to the whispers of the kidneys. One of the earliest places diabetes shows itself is the skin. Many warning signs are dismissed as harmless or unrelated. The skin is highly sensitive to changes in blood sugar. When glucose stays elevated, even mildly, the skin reacts. High blood sugar damages small vessels, reduces circulation, and increases inflammation, which leads to visible changes. These visible shifts often appear long before diabetes is officially diagnosed. Recognizing them early is vital. Sign number 1 is the appearance of dark, velvety skin patches. These are most common on the neck and armpits. The skin may look darker, thicker, or velvety in texture. This condition is called acanthosis nigricans. This is not dirt or poor hygiene. It is a strong sign of insulin resistance, a key precursor to type 2 diabetes. Sign number 2 is dry, itchy, or cracked skin. This happens even when you feel you're adequately hydrated. High blood sugar pulls fluid out of your cells and reduces circulation, causing moisture to decrease and healing to slow. Many treat this with creams without addressing the underlying cause. Persistence in these changes matters most. Why are these signs so often missed? Because they develop slowly and are usually painless, they look very common. People assume it's just aging or the weather, but consistent skin changes deserve a professional evaluation. Body composition shifts and skin patterns are messages from your metabolic system that shouldn't be ignored. Seeing one change doesn't confirm diabetes, but paired with fatigue or abdominal weight gain, it's a reason to pay attention. Your family history and your physical symptoms together create a clearer picture of your internal blood sugar health. So, what should you do? Observe where the changes are, how long they've been present, and if they are spreading. Discuss these observations with a healthcare professional. Early testing and intervention can make a massive difference. Professional evaluation through simple tests can provide the clarity you need to protect your long-term health. The skin often shows blood sugar problems before lab results become abnormal. It is a vital early warning system. Recognizing these signals early allows for proactive care. Your awareness is your best tool for metabolic protection. Thank you for watching Part 2. In our next segment, we will discuss how changes in your vision can signal blood sugar issues. Invest in your structure, and you invest in your strength. We'll see you in Part 3. Many people think eye problems only happen after diabetes is diagnosed, but the eyes are actually one of the earliest places blood sugar problems show up. And these changes are often subtle at first, so subtle that people ignore them. Why does diabetes affect the eyes? Blood sugar levels directly affect tiny blood vessels, fluid balance, and nerve function. The eyes are filled with very small, delicate vessels. Repeated spikes can cause them to swell, leak, or change shape. That's why vision can change before diabetes is even confirmed on blood tests. Sign 3, blurry or fluctuating vision. One of the most common early signs is vision that comes and goes. People say glasses don't work consistently. High blood sugar changes how fluid moves in and out of the lens. The lens swells, focus shifts, and vision blurs. Fluctuating vision is a key clue. Sign 4, difficulty seeing clearly after meals. Some notice their vision gets worse after eating, later in the day, or when they feel tired. Meals that spike blood sugar can temporarily distort vision. This is often blamed on eye strain or screens, but it may be metabolic. Why are these changes missed? Because they come and go and don't cause pain. People assume they just need new glasses or they're just tired. Persistent fluctuation is not normal. Early changes do not mean permanent damage, but they mean blood sugar may be unstable. Addressing this early can protect long-term vision. Ignoring it allows damage to accumulate. Do not panic, but do pay attention to timing. Mention these patterns to both your healthcare provider and your eye doctor. They often provide critical clues together. Closing for part 3. The eyes don't just help you see the world, they reflect what's happening inside your body. Fluctuating vision is an early warning sign. Stay informed and stay proactive. We'll see you in the next part of our series on understanding your metabolic health. The kidneys are vital organs. They filter waste, balance fluids, regulate blood pressure, support red blood cell production, maintain mineral balance. And yet, kidney disease is one of the most commonly missed medical conditions. Why? Because kidney disease usually does not cause pain, especially in the early stages. Instead, the body shows visible signs on the face, on the skin, in the legs, in the nails, in body shape. These signs often appear long before someone is diagnosed with kidney disease. Why kidney disease is often silent. The kidneys have very few pain receptors, so damage can progress quietly. You may not feel sharp pain, sudden symptoms, clear warning, but the kidneys affect fluid balance, circulation, and waste removal. When they struggle, visible changes appear. That's how the body communicates early kidney stress. Why visible signs matter. Blood tests are not always done routinely. Early kidney disease can exist even when energy seems okay. Urination seems normal, but visible signs often show up early. If you know what to look for. They are clues, not diagnoses, but important clues. What this series is and is not. This series is educational, preventive, awareness-based. It is not about fear. It is not about self-diagnosis. Seeing one sign does not mean kidney disease, but seeing patterns, especially when signs repeat or progress, matters. Why the kidneys affect the entire body. The kidneys regulate fluid levels, electrolytes, blood pressure, waste products. That's why signs appear far beyond the urinary system. Who should pay special attention? This series is especially important if you have diabetes or high blood pressure, have heart disease, take long-term medications, have a family history, or are over age 50. Do not panic. Do not self-diagnose. Instead, observe changes over time, notice patterns, discuss them with a healthcare professional. Early kidney disease is often manageable. Advanced kidney disease is far more difficult to treat. Timing matters. Learning to recognize those signs early can protect your kidneys and your future health. Join us as we learn to listen to the whispers of the kidneys. One of the most overlooked visible signs of diabetes involves how the body heals. Cuts, scratches, and minor wounds. Things that used to heal quickly may suddenly take much longer. Many don't connect this delay to their blood sugar. Healthy healing depends on circulation and your immune response. When blood sugar stays elevated, these systems struggle. High blood sugar causes vessels to narrow and oxygen delivery to drop. The result is slower tissue repair across the body. This often happens before diabetes is even diagnosed. Recognizing the pattern can lead to earlier proactive care. Sign number 8 is cuts that heal slowly. Pay attention to how long everyday skin breaks take to resolve. Small cuts taking weeks to heal or scrapes that stay red longer than expected are important clues from your system. These are not dramatic injuries. They're everyday breaks that just don't resolve normally. That delay is a metabolic message. Sign number 9 is frequent skin or body infections. High blood sugar creates an environment where bacteria thrive. You may experience boils, abscesses, or fungal infections repeatedly, even if your hygiene habits are excellent. If infections occur frequently, despite good care, it is time to evaluate your internal blood sugar balance. High glucose directly affects your white blood cells. This doesn't mean your system is weak, it means it's disrupted. Immune cells respond more slowly and inflammation increases. Metabolism is getting in the way of your natural defenses. Why are these signs so often missed? People blame bad luck, aging, or sensitivity. But repetition matters. One infection may not mean much, but several over a few months create a clear signal that your liver or kidneys need review. Tracking how often you struggle with these issues is your first step toward getting the right diagnostic answers. Slow healing alone isn't a diagnosis, but combined with skin or weight shifts, it strengthens the clinical pattern. Discuss these observations with a professional. Early blood sugar testing can prevent long-term complications from arising. So, notice how long wounds take to close and how often infections occur. These are critical details for your doctor. Simple tests can clarify exactly what's happening with your metabolism and help you regain your internal balance. Healing speed reflects your internal balance. When blood sugar is unstable, your body's repair systems slow down visibly. Recognizing these signs early is your first line of defense. Thank you for following our diabetes series. Invest in your awareness, and you invest in your strength. We'll see you in the next part. One of the most confusing early signs of diabetes is constant hunger. You eat, you feel full, and then, not long after, you're hungry again. This is not a lack of willpower. It's a metabolic signal. Why does diabetes affect hunger? It all comes down to energy access. Glucose is supposed to move from the blood into cells for energy. Insulin is the hormone that helps this happen. But when it doesn't work properly, problems arise. Glucose stays in the blood and cells remain underfueled. The brain thinks the body is starving, so hunger signals stay turned on. Sign 10. Hunger soon after meals. People notice hunger returning within 1 to 2 hours or feeling unsatisfied after a full meal. This happens because blood sugar rises quickly, then falls quickly. Those swings trigger hunger as the body tries to correct instability. Sign 11. Strong cravings for sugar or carbs, especially for sweets, bread, pasta, or snacks. These cravings are not random. They're driven by the brain seeking fast energy when cells can't access glucose efficiently. Why this is often misunderstood. Many blame stress or emotional eating, but when hunger feels urgent and repetitive, it's often physiological, the body asking for help. Why this matters. Frequent hunger encourages overeating and reinforces insulin resistance. This creates a cycle that becomes harder to break over time. Recognizing it early is key. Feeling hungry doesn't automatically mean diabetes, but persistent hunger that returns quickly, especially with other signs, should be taken seriously. Pay attention to patterns and food triggers. Share these with a professional. Early metabolic changes are often reversible. Closing for part 6. Hunger is not just about food, it's about energy access. When the body can't use glucose properly, hunger becomes louder. Listen to what your body is saying. Stay informed and stay proactive. We'll see you in the next part of our series on understanding your metabolic health. Fatigue is one of the most common signs of diabetes, but it's also one of the most misunderstood because fatigue isn't just something you feel, it's something that often shows. On the face, in posture, in movement. Why diabetes causes fatigue? Even when blood sugar is high, cells may not be getting enough usable energy. That's because insulin isn't doing its job efficiently, so the body feels tired, even after rest, and over time, that fatigue becomes visible. Sign number 12. Tired-looking face. People may notice dark circles under the eyes, a dull or grayish skin tone, a worn-out appearance. This isn't just lack of sleep. Poor glucose control affects circulation and tissue repair, which shows on the face. Sign number 13. Low energy movement. Another visible sign is how the body moves. People may move more slowly, take longer to stand or walk, avoid physical tasks that used to feel easy. This happens because muscles are not receiving steady energy. They fatigue faster. Why this is often missed. Fatigue is often blamed on aging, stress, poor sleep, busy schedules, but metabolism should be considered. But when fatigue persists, worsens over time, or comes with other signs, it deserves closer attention. Why fatigue matters in diabetes. Chronic fatigue reduces physical activity, worsens insulin resistance, increases weight gain risk. It becomes part of a self-reinforcing cycle. Recognizing fatigue early helps break that cycle. What these signs do and do not mean. Feeling tired does not automatically mean diabetes, but visible fatigue combined with hunger, weight changes, skin or vision changes, strengthens the pattern. What to do if you notice visible fatigue? Pay attention to changes in energy over months, whether rest helps, whether daily tasks feel harder. These observations are valuable. These observations are valuable during medical visits. Fatigue is not just a feeling, it's a visible signal. Learning to see these signs early can protect your future health. Join us next time as we continue to listen to your body. Notice the signs. Protect your future. Some of the most well-known signs of diabetes are also some of the most misunderstood. Thirst and frequent urination can appear much earlier than most realize. They often show up quietly as patterns, not dramatic symptoms. Why does diabetes cause thirst? It starts with the kidneys. When blood sugar rises, excess glucose spills into the urine. Glucose pulls water with it, meaning the body loses more fluid than normal. To compensate, the brain triggers thirst. This is the body trying to protect itself. Sign 14. Constant or unusual thirst. People notice feeling thirsty even after drinking water or needing to sip water throughout the day. This thirst is persistent and returns quickly. Dry mouth that doesn't fully improve is another sign. Sign 15. Frequent urination. Along with thirst, you may notice needing to go more often. Waking up multiple times at night to use the bathroom is especially important. It may reflect blood sugar issues, not just aging. People assume it's just drinking more water or normal aging. But when thirst and urination increase together, metabolism should be considered. Why this matters? Repeated fluid loss contributes to fatigue, dry skin, and affects concentration. It's part of a larger metabolic imbalance. Do not ignore these persistent changes. These signs are more meaningful when they happen together or with other visible signs. Pay attention to how often you're thirsty and your nighttime habits. Whether this pattern is new is an important detail to share with a professional. Simple tests can clarify what's happening. Closing for Part 8. Thirst and urination are not just about hydration. They are about how the body handles sugar. Listen to your body's early messages. Understanding these signals is the first step toward better metabolic health. We'll see you in the next part of our series. Stay informed and stay proactive. Your health depends on recognizing these quiet patterns early. By now, you've seen something important. Diabetes rarely appears all at once. It develops gradually, and along the way, the body sends visible signals. Not pain, not emergencies, but changes you can see if you know where to look. Why patterns matter more than single signs. Seeing one sign does not mean diabetes, but seeing several signs together tells a different story. Together, they form a meaningful pattern. Skin changes, vision fluctuations, slow healing, fatigue, thirst. Each alone may seem harmless. Together, they are how the body communicates early. Many ask, how can I have signs if my tests are normal? Here's why. In early stages, blood sugar may only spike after meals. Fasting levels stay normal. The body compensates for a while. By the time tests are clearly abnormal, the process has often been present for years. Visible signs matter first. The most important message: early blood sugar problems are often reversible. Late complications are not. Catching it early protects your long-term health. Catching diabetes early can protect vision, preserve nerve function, and prevent kidney or heart damage. Waiting removes options. Acting creates them. What to do if you recognize multiple signs? You do not panic. You do not self-diagnose. You pay attention to patterns and write them down. Discuss it calmly with a professional. Ask about fasting glucose and HbA1c. Awareness is proactive, not dramatic. Who should be especially vigilant? Pay close attention if you are over 40, have a family history, or carry weight around the abdomen. High blood pressure or cholesterol are also flags. But remember, diabetes can affect anyone. Your body is intelligent. It whispers before it shouts. Visible signs are meant to guide you early. They guide you calmly and effectively. If this series helped you understand your body better, please like and subscribe for more evidence-based education. Share this with someone who might need it. Early awareness changes lives. Protect your health and stay proactive.